For years, controlling blood sugar has been considered a cornerstone of good health, particularly for those managing diabetes. Regular monitoring, dietary adjustments, and medication adherence have all been emphasized to maintain blood glucose within an optimal range. However, new research suggests that for older adults, an intense focus on blood sugar control may not be as beneficial as once thought. In fact, rigidly adhering to traditional blood sugar targets may sometimes do more harm than good, particularly when it comes to the risk of hypoglycemia. These findings highlight an important shift in how we think about diabetes management in aging populations, offering a more balanced and individualized approach to care. Diabetes management has long been centered around maintaining a hemoglobin A1C level below 5.7% for those without diabetes, and between 5.7% and 6.4% for those with prediabetes. For individuals with diabetes, doctors have typically recommended keeping A1C levels under 7% to reduce the risk of complications such as nerve damage, kidney disease, and heart problems. While these guidelines have been effective for many, geriatric experts are now raising concerns that these strict targets may not be ideal for older adults. The reason? As people age, their bodies respond differently to blood sugar fluctuations, and aggressive glucose control may increase their vulnerability to dangerously low blood sugar levels, known as hypoglycemia. Hypoglycemia, which occurs when blood sugar drops below 70 milligrams per deciliter, can be particularly dangerous for older adults. Unlike younger individuals who may be able to quickly recognize and address low blood sugar symptoms, older adults may experience more severe effects, including dizziness, confusion, and an increased risk of falls. In more extreme cases, hypoglycemia can lead to stroke, cognitive decline, loss of consciousness, or even death. Given that older adults are often managing multiple health conditions and taking various medications, the risks associated with low blood sugar become even more pronounced. The growing recognition of these risks has led medical experts, including the American Geriatric Society, to recommend a more flexible approach to blood sugar management for older adults. Instead of aiming for an A1C level under 7%, older individuals, particularly those with other health conditions, may benefit from a target range of 7.5% to 8%, or even up to 9% in some cases. This approach prioritizes overall well-being and quality of life rather than rigid adherence to traditional blood sugar targets. For many older adults, this shift in guidance can feel confusing and even frustrating. After years of being told to keep their blood sugar levels tightly controlled, being advised to loosen those restrictions may seem contradictory. Some individuals who have spent decades carefully managing their diabetes may feel uncertain about adjusting their routines. However, this new perspective is not about neglecting diabetes care. It's about recognizing that health priorities change with age. The goal is to prevent immediate dangers, such as falls and cognitive impairment, rather than solely focusing on long-term complications that may no longer be as relevant for aging individuals. This evolving approach to diabetes management also underscores the importance of personalized care. No single blood sugar target fits all, and doctors are increasingly encouraged to consider an individual's overall health, lifestyle, and medical history when recommending treatment strategies. By shifting the focus away from rigid numbers and toward overall well-being, older adults can potentially enjoy a better quality of life while still effectively managing their diabetes. Ultimately, this research highlights the importance of adaptability in healthcare. As medical knowledge advances, recommendations evolve to better align with the needs of different populations. While strict blood sugar control may have been the standard for years, emerging evidence suggests that a more flexible approach may be the key to safer, healthier aging for individuals with diabetes. This shift is a reminder that health management is not one size fits all, and that a more individualized approach can lead to better outcomes and a higher quality of life for older adults.